Hey, I'm Dr. Merrill here at Nightlight Chiropractic, and over the next few minutes, we're going to cover with you exactly what you need to do to have the best chance of passing your DOT physical. Before we get to some of the secrets that the medical community doesn't even want me to talk to you about, we're going to cover some of the elements of the exam. So if you've had one of these DOT exams done before, you know that they're all relatively similar. You'll come in, we start with doing some forms, we'll go over your past medical history, any medications you might be taking, any previous illnesses that you might have. After that, we'll do a urinalysis where we're checking for protein, blood, and sugar in your urine. We're not checking for drugs, so that's that. We'll take your height and weight. We'll go over a brief physical exam with you. We'll check your eyes. We'll check your hearing. And then the most important part, I think, that trips up a lot of our drivers is we'll do a blood pressure. Right? So when we check your blood pressure, that seems to be where most of our drivers are not able to pass because their blood pressure is too high. And it's a really common theme here in America where we all have a lot of high blood pressure kind of running around. And so right now, I'm going to go over how you can make sure that your blood pressure is low enough so that you can pass this exam. Now, I want you to understand, these are all natural tricks, if you want to call them that, or tips. There's nothing untoward about this. There's nothing nefarious about this. This is just to make sure that your blood pressure is within range when you have it tested. So if you have a few days to prepare, that's going to be better because then you can start to make healthy choices. Get good sleep, avoid salty foods, decrease or quit smoking, avoid alcohol. We all know that these things reduce your blood pressure over the course of a few days. So if you have a few days to prepare, you want to make sure that you start now. If you don't have a few days to prepare, and we see this much more commonly, right? Maybe you're driving down the road and suddenly you look at your little DOT card there and you're like, oh my gosh, I have 24 hours to get this done. I got to get this done by tomorrow. Otherwise it's expired. And so we want to give you the tips and tricks that you can use in 24 to 48 hours to make sure that you can pass this blood pressure check, this blood pressure test. All right, so first, you want to make sure that you get a good night's sleep, right? Like I just mentioned a minute ago, it's going to help to lower your blood pressure right there. Second, you need to let your examiner know if you have white coat syndrome, right? So there is a condition out there where when you see this white coat, you start to get nervous that somebody's about to check your blood pressure goes up because you get into that fight or flight response. If you let your examiner know that you suffer from this, they can help to make sure that they are keeping you relaxed so that your blood pressure stays low so that you have a better chance to come back within range there. Again, you want to avoid salty foods. So the day of the exam, you don't want to have a big lunch of like spicy food, salty food. You definitely want to avoid alcohol. You want to avoid nicotine and alcohol for at least an hour prior to taking this exam, if not more. Now we're going to get a little bit more esoteric, right? So there's some great research out of St. Bartholomew's Hospital in London, which showed that if you drink beet juice 2 hours prior to having your blood pressure taken, it comes back substantially lower. So if you can find beet juice, you can find it at most local grocery stores. Grab yourself a bottle of that, and that's going to help to reduce your blood pressure. If you can take a walk for about 15 minutes before you have your blood pressure taken, it's also going to come back just a little bit lower. And now maybe the most important trick, and I couldn't believe this when I came across it, they took 20,000 patients who were going into a medical facility to have their blood pressure taken in Japan back in 2005. And what they did was they had them do deep breathing exercises just prior to having their blood pressure taken, and it came back substantially lower. So here's what we're going to do. We're going to do this deep breathing exercise where you're going to set a timer for 30 seconds, and then you're going to take 6 deep breaths within that 30-second time period, right? Sounds really easy, but if you haven't practiced it a few times, it's hard to get it exactly right and the timing and the tempo of taking those deep breaths. So practice a few times, but if you close your eyes, relax, take those 6 deep breaths within the 30-second period, what you'll notice is that your blood pressure goes down. You'll feel a little bit calmer, but more importantly, your blood pressure actually goes down. And so if you want to give yourself the best chance of passing this DOT physical on the first try, it's going to be taking these deep breaths before you have your blood pressure taken. Anyways, I hope this helped you to maybe pass your DOT physical the next time around. We do these DOT physicals here Monday through Thursday, noon to 9, and Fridays from noon to 6, right here in downtown Orlando. It's $75 for an exam. If we can help you, you can click the link here just below, and we'll get you in, get you scheduled, get you taken care of so that you can get back on the road and drive safely. Hope this helps. Have a great day. We'll see you here in the office next time you need a DOT physical.